Okay, this is another video. This one is for my friend Joe in Florida, but of course for anybody else who has reason to use it. This is what I'm calling a percutaneous pre-sacral neurectomy now. It's essentially an alcohol neurolysis of the inferior hypogastric plexus and the hypogastric nerves that connect the superior hypogastric plexus and the inferior hypogastric plexus. And it's for patients with pelvic masses, deep pelvic pain, etc. And the access site really is at the sacrococcygeal junction right there. So you're going to be able to scroll and find these foramen and access into this pre-sacral space where there are web-like nerves that we want to ablate. And so if I move to the needle placements, then try and window this a little bit more. There's the needle placements, and this is a little bit of contrast and lidocaine to make sure that we're in the right space. You don't want to put a lot of contrast and or lidocaine into this space because you don't want to dilute the alcohol and decrease its effect, its dehydration effect. The thing that can go wrong here is that your injectate can spread laterally and get into the sciatic nerves. So you want to keep your eye on this with intermittent fluoro, but this is your access and this is your initial confirmation with some contrast. And the post scan then, and scan up here. So the post scan, here we are coming down. And we start to see alcohol. There's a little bit anterior there. The majority of the alcohol, of course, is black, is layering in that pre-sacral space there. That's a good image. This is all alcohol here, anteriorly, but not spread laterally. There's another good image. And so you can see how the distribution of our injectate as we go down is essentially replicating. I mean, look at that. This is all alcohol. Is essentially replicating the pre-sacral neurectomy and dehydrating that plexus to give someone with deep pelvic pain, oftentimes related to a mass or other, relief. So thank you, everyone.